Basically, young adults who present to us with hip and groin pain can have a number of etiologies that cause this condition. The first and most important thing is to perform a thorough physical exam, which may seem obvious, but sometimes gets ignored. Um, the most important part of the physical exam is to really ascertain what part of the hip causes pain. Is it something that's potentially even completely outside of the hip joint? Is it extra-articular? Is it a bursa situation or a tight IT band? However, if the patient presents with groin pain, specific um, uh, maneuvers can elicit that type of groin pain, and that sort of leads us and cones us down into a condition that really is affecting the inside of the joint. The next step after a physical exam that sort of guides your treatment is the radiological studies, and these are very important. You don't have to rush to an MRI because an X-ray can really tell you a tremendous amount about what the condition is, and the MRI usually serves as sort of adjunct and provides adjunct information. Specifically on the X-ray, if a patient already has arthritis, there's really nothing else that needs to be done, and the solution is either a hip replacement or a hip resurfacing of some sort. When the patient does not have hip arthritis, then what the X-ray can reveal for you is if there's any sort of morphological features that make the hip abnormal, such as a femoral acetabular impingement or a hip dysplasia, or even a pediatric condition that was ignored, such as an old slip caput femoral epiphysis or a Perthes deformity. All of these can sort of guide your next step in radiology assessment, and then at that point you can choose an MRI or a CT scan or a combination of the two. I think the treatment algorithm is not is not difficult to adopt. It really the most important part of it is to understand what the etiologies of hip pain are. That not all types of hip pain are just a strained muscle or a strained groin injury in a young patient. That a careful physical exam will often lead you to the correct answer, and that the appropriate radiological studies can lead you to the next step where you can decide what the surgical intervention, if any, would be the ideal one.